Here is a picture of the autonomic nervous system. When that little rabbit was in the forest and he was just relaxing and feeling happy, his cholinergic system was working well. He had two nervous systems, a cholinergic and an adrenergic, or a parasympathetic and a sympathetic. The sympathetic was named after the fact that the ganglia are in sympathy with the vertebra. So ancient anatomists call this sympathetic. And parasympathetic means outside of the sympathetic. The cholinergic name comes from acetylcholine, which is the neurotransmitter, and the adrenergic system comes from noradrenaline or norepi in this country. So we have the parasympathetic or cholinergic nervous system. So cholinergic drugs or cholinergic influence causes small pupil miosis, relaxation. It causes rest and digest. He's chewing up his food, so his saliva is pouring out. It slows the heart rate and relaxes the heart. It tends to constrict the bronchi because they're not needed to be open for action. The cholinergic system has no connection to the blood vessels. It stimulates gastric motility and acid. It stimulates intestinal motility, and it stimulates the bladder to the bladder wall, the detrusor muscle, to contract, and it also opens up the sphincter, allowing for urination. So cholinergic is rest and digest, where the sympathetic or adrenergic is for flight or fright or fight. Mydriasis, it opens the eye. It stimulates radial muscles, which open the pupil, where these the cholinergic stimulates little circular muscles which constrict and contract the pupil. Inhibits secretion. It accelerates the heart through beta-1, which they would label the beta-1 receptors, stimulate heart rate. They stimulate velocity and firing to get more blood, more oxygen. It opens up the blood vessels. The sympathetic nervous system has two types of receptors which work on blood vessels. One type which is involved with dilation, beta-2, and one type which is involved with vasoconstriction, alpha-1. And the sympathetic nervous system opens up the bronchial tubes, so beta-2 receptors do that. They have minimal action, somewhat, but minimal action on the gut here. But another predominant action is in the detrusor muscle. The sympathetic nervous system relaxes the detrusor muscle, and it constricts through alpha-1. It constricts the sphincter so that if you're involved with flight or fright, you would not be stopping to urinate or move your bowels. So it would have little action on the bowels, and it would prevent or reduce the possibility of urination. So cholinergic is rest, digest. Meiosis, small pupil, lots of salivation, slowing the heart rate by the acetylcholine, attacking or attaching to the SA node in the heart and slowing down firing. It would have no effect on blood vessels. It would relax the bronchi and contract them slightly. It would stimulate digestion, stomach, acid, propulsion, peristalsis, and it would tend to work on the detrusor muscle to cause urine to flow, and it would open up the sphincter. So drugs which are cholinergic or agonists at the cholinergic or parasympathetic nervous system, which are cholinergic or cholinomimetics to mimic, or parasympathomimetics to mimic, would tend to cause all of these things to happen. Naturally, if you had something which was an antagonist, it would be anticholinergic. It would go to these receptors and block them, which would then give a result that would be very similar to what would happen on the other side here with the sympathetic. So blockers of cholinergic or parasympatholytic, they would tend to reduce cholinergic tone or flow and then you would have more of the sympathetic. So in a quick nutshell in 5 minutes, that is a beginning for the autonomic nervous system.